Yeah, this is where this section on definitions, and particularly definitions around dwelling event. And I just want to really point out the sort of preposterousness of this and the misguided focus that it implies, which really, lies at the centre of how misguided this entire legislation is, namely trying to suggest that the primary responsibility that we need to focus on in terms of understanding the rising infection rate we've seen and the necessity to resort to another lockdown is somehow to do with events in people's homes. And indeed, it is a narrative that I've heard repeated endlessly with, for example, the commentary that it is households where we are seeing a majority of cases and so on, failing to point out the very obvious, that we had pretty much or close to eliminated community transmission as a result of the actions of hundreds of thousands of households, millions of households in this country, overwhelmingly done on a voluntary basis the last time round, because people understood the need to act quickly to deal with the virus. But despite the fact that the people had done their part and largely eliminated community transmission, it came back. And where did it come back from? It wasn't from people's houses at that point. It was from the places that the government refused to act against, and which it doesn't focus on in any serious way at all in this bill, namely the meat processing plants, the direct provision centres and so on, which this bill doesn't focus on. And most crucially of all, the policy decision of this government to essentially say there is an acceptable level which we can manage of community transmission, which it is now absolutely clear you can't manage, you haven't managed, and has now run out of control, and then it goes back into people's homes, not surprisingly. But the implication that it started in people's homes is simply, to my mind, not true and not evidence-based. And indeed, it is worth pointing out a simple thing. Everybody lives in a home, right? Everybody lives in a home. So that tells us absolutely nothing about the virus. How did it get into the home? Did it come through the walls? No, it didn't come through the walls. It came from a policy decision made by this government that it's possible to live beside the virus. And it's now clearly apparent you can't live beside this virus. This virus doesn't respect level 2, level 3, level 4. It has its own logic and dynamic, and either we chase it down or it chases us. And that's precisely what has happened. And to blame the people or events in people's homes for this is absolutely, it's deflection away from the government's own political responsibility. And it should be that responsibility the government is big enough to own up to, rather than trying to redirect that against the family home and then give enforcement powers to the police, really as a way of scapegoating. No other way to put it, scapegoating individuals and families for doing normal human family things, rather than blaming the government for having a failed strategy and for failing to resource our public health services and the public health response to the degree necessary to control outbreaks.
So, Deputies Boyd Barrett and Pringle were speaking to the section and raising the point around dwelling events and having that in there at all. And if I understood correctly, the argument is that by having measures that point to things going on in a house, we are therefore somehow, I think the three words used were blaming, scapegoating and attacking people who live in houses. I would just say if that's your view, that's fine, but then you would have to apply that to every measure. So the regulations speak to, as Deputy McGrath has said, religious events. By the way, deputies, the churches are not closed. Anyone can go into can go into a church. But it would also suggest that anything that is pointed to in the regulations, be it sporting events or travel or anything, that they are somehow being blamed. That's not what we're doing here. The approach from day one, and the approach as laid out in Section 2 of the bill, is to say we've got to be as targeted as possible in suppressing the virus. Therefore, as we get better and better evidence as to where the virus spreads, they're the interactions that we want to target in order to protect human life, human health, the healthcare services, the education services, childcare services and jobs. That is broadly the strategy being deployed. So what I would say to the deputies, the reason it's in there for Section 2 is because there's very, very strong evidence from public health that the single biggest place the virus is now spreading is within households and between households. So that bit isn't really a matter for opinion. They're the facts based on the testing system, based on the contact tracing system. So the advice I have from the Chief Medical Officer and the data backing it up says the majority of transmission is happening within households and across households. They therefore deem it necessary, and government agrees, that those locations which are now the majority location for transmission need to be looked at, and that's why the definition is in there in section 2. Thank you, Lascian.